March may be the most important month of the year, and I'm not just talking basketball. March is Colon Cancer Awareness Month.
Colon cancer is preventable, and there is this fear attached to colonoscopies, and I think that getting the word, it's our job as physicians to get the word out to encourage people to get screened.
Colon cancer doesn't pay attention to the calendar. It occurs all the time, and as gastroenterologists, this is our job. So we're looking for colon cancer and doing colonoscopies every day, every week, all year. And the more we look for it, the more we find, the more we're able to prevent. And that's how we can prevent the disease from occurring in the first place.
Colon cancer is really arguably our most preventable malignancy. And by having what is really a simple test, we can prevent cancer. And there are not many other areas in medicine where we can make that guarantee, if you will. There's a lot of stigma attached to it, but it's a relatively simple test. I've had it myself 4 times because both my parents have had colon cancer, and they weren't screened early on routinely, and they ended up having a lot more health care needed to make sure that they survived that life-threatening illness.
A lot of times people think that if they don't have symptoms, they don't have problems, it's not something they need to do. But it's unfortunately one of those diseases that doesn't usually have symptoms, or when you get them, it's too late. And so if you can sort of get over the initial hurdle to come in and get it done, it's an important procedure, and we take it very seriously, and it's our job to educate the community and do the procedures and try to prevent cancer from occurring in as many people as possible.
I mean, in general, what we're talking about, which is general average risk screening related to age, that starts at age 50. But there are specialized populations where screening must start earlier. And those are people with a family history of colon cancer or important colonic polyps. There are other intestinal disorders where it's important to start screening earlier than 50. So I think it's important and incumbent upon the primary care physician and the patient to exchange that knowledge so that they can get in and get the test at the appropriate time. That screening, obviously any type of symptoms that are unusual, bleeding, a change in bowel pattern, unusual abdominal pain, that should be brought up to the physician, and then they can determine if a colonoscopy would be warranted, really not for screening purposes, but to understand what the symptoms are from.
This message was brought to you by University Gastroenterology. Visit us at universitygi.com. And University Endoscopy Group. Diagnose, prevent, treat, defeat.